You've probably heard of Madonna here in Lincoln. You may have even driven by it, but do you know what goes on inside?
The Rehabilitation Hospital is one of the most advanced pediatric centers in the region. Last year, serving more than 450 kids. Tonight, meet one of them, a football player on the road to recovery. In the huddle, it's about the team, not the player. James McGinnis there in orange, trying to help Olathe East win the game. September 12th, third quarter, the senior linebacker collapsed 2 plays after a solo tackle. 5 months later, the 18-year-old is still fighting, this time surrounded by a new team in the game of life.
I've learned more than I've ever wanted to know about traumatic brain injuries. And the biggest thing is no 2 traumatic brain injuries are the same.
For James, it meant surgery to remove a piece of his skull, a feeding tube. He couldn't eat or speak. The left side of his body couldn't move. Out of 3 rehab options, the Kansas family chose Lincoln.
Immediately, as soon as people in our area heard that Madonna was one of them, they're like, you've got to go there. It is the best place in the world for James.
The Alexis Verzal Children's Rehabilitation Hospital opened 4 years ago. The 14-bed inpatient pediatric unit began with a $1.2 million donation by Larry the Cable Guy.
Here you can give to Madonna, and they help hundreds of families. So
the average patient is 10, many of the kids coming from all over the Midwest.
We have people that know more about Madonna and what they do from Michigan or Kansas or Missouri than people even within Lincoln.
Skilled therapists work with patients like James, and teachers help keep them current with curriculum. The whole team takes a realistic but optimistic approach. After months of hard work, James is now reading, writing, speaking, and even singing. He's also learning how to walk, and Mom Susan has been there every step of the way.
Just to watch how they take care of him is just, it's a miracle.
He can express how he's feeling, his wants. He's able to talk to family, his girlfriend, make jokes, laugh. I mean, it's really been neat to see.
The smile's sure to grow if James meets his next goal, walk across the stage at his graduation in May.
Being able to watch kids succeed and thrive rather than be pitied or protected too much is really what we always try to do.
No doubt Madonna star player will give it his best shot.
Let's go left here.
Great kid there. James's mom says it is not a question of if he'll walk, it is when. Tomorrow night at 10, I'll give you an exclusive look at technology Madonna is working on to help make that happen for patients like James.
They do a great job over there. I know you've done a lot of these health reports here in the last 2 or 3 weeks. If you've missed them, no problem. Go to KOKNTV.com and click on the Health tab. Last night, we took you inside the pediatric unit of Madonna Rehab here in Lincoln.
Tonight, I'm giving you an up-close look at some of the incredible technology they are working on to help children walk. Here's an exclusive look in my HealthWise report. Big things are happening at Madonna, especially in the Movement and Neurosciences Center. This lab is the birthplace of a special training device called iCare. It helps adults relearn how to walk after a stroke, spinal cord, or brain injury. The system was developed through a special grant and a collaboration with Sports Art and is now being adapted for kids through another one.
We'll be able to really have one device that can be used across the continuum of care for people from 3 to 99 years of age.
The smart machine has already won an International Da Vinci Award for innovation. The adult version is being sold worldwide from Australia to South America. It's also in rehab facilities across the country. The center's director, Judith Burnfield, says to teach a person how to walk, you have to teach them a task very similar. That's where the iCare comes in. It emulates the movements fine-tuned through research.
We determined that by actually studying the way people move as they walk. So we put little reflective markers on their body and we track the motions that their joints produce as they're walking.
Burnfield says the key to relearning is repetition, helping your muscles become stronger and the pathways in your brain more efficient. iCare's technology picks up the slack when the patient is weak without putting that weight burden on a human helper.
As she's going through the movement cycle, there are actually sensors built into the iCare to sense in the movement cycle where she needs help. Much like a clinician's hands in the traditional physical therapy environment might sense when a person needs help and lift and advance the leg.
The same concept will translate to kids. This one perfectly healthy, helping researchers at Madonna's Institute perfect eye care for children. A 12-camera motion analysis system tracks him as he walks. This is the second year of a 3-year, $600,000 grant. The goal, make eye care more common in the rehab world so it can help more people at a fraction of the cost.
Oftentimes the technology that can be used to give that mass repetition is really expensive. For example, robotic devices can cost upwards of $300,000. That's hard for smaller clinics and hospitals around the country to be able to afford.
Each eye care system is about 1/10 that price, and the benefit may be even priceless for those who use it.
I will bring you another HealthWise report Tuesday night at 10, and if you've missed any, we have a bunch of them, you can watch them on our website.
That's right. All the people have to do is go to KLKNTV.com and look under the Health tab. So far this year, more than 120 measles cases have been confirmed in 17 states and D.C., and 2 of those right here in Nebraska.
And behind the spread, parents choosing not to vaccinate, a personal decision many critics say is as irresponsible as driving drunk. So what should you know? Here's tonight's HealthWise report.
I find this very worrisome. This is a disease we knocked out in 2000.
In 2015, 121 measles cases and counting. In fact, more in the month of January than in any one month in the past 20 years. All because fewer people are getting vaccinated.
When you start seeing that number drop below what we call herd immunity threshold, then everybody's susceptible.
Dr. Paul Bernhardson has been taking a lot of calls about measles at his Lincoln office. He wants people to know links between shots and autism have been discredited. He says in studies of kids that were vaccinated and unvaccinated, the incidence of autism were the same.
It's not been the vaccine. I mean, if you were going back to, gee, the measles, mumps, rubella vaccine was the cause, we started doing the 3 of them together, late 60s, early 70s, you would have expected autism to go up dramatically right then, and it didn't.
Some other things to keep in mind: droplets from someone infected with measles can linger in the air for 2 hours. If exposed and not vaccinated, you have a 90% chance of getting it. Within 7 to 12 days after exposure, you may get a runny nose, cough, high fever, and red eyes. You can be contagious for 4 days before that telltale rash shows up. Wondering if you're protected? If you were born after 1977, you likely had 2 doses of the MMR vaccine and are covered. Before 1957, you were probably exposed and are immune. Doctors say it's that 1957 to 1977 period where you might need a booster. If you're unsure, you can get a blood test to find out or get another shot just in case.
The risk of having the disease far outweighs the risk of the vaccine.
And speaking of vaccinations, that Lincoln doctor says more people need to get protected against pertussis, something we are seeing a lot of here in Nebraska.
Very true. You've been putting a lot of these health pieces together. If people have missed them, all they have to do is go to our website, KLKNTV.com, and click on the Health tab, right?
Exactly. Scroll down for the HealthWise reports, and I'll have another one tomorrow night at 10.
This Valentine's Day, you're invited to roll up a sleeve and give the gift of life.
There is a special blood drive, all in honor of a Lincoln man who fought a courageous battle with cancer. I've got the details for you in tonight's HealthWise report.
He was a fighter. He loved people. He loved to joke. There wasn't anybody that wasn't a friend to him.
On February 15th, Mike Stewart would have turned 63. This time last year, the Lincoln native was battling myelodysplastic syndrome and T-cell lymphoma, a disease that left him low on healthy blood cells. On his last birthday, Mike's sister Becky created a blood drive in his honor. This year, she's teaming up with the Red Cross on Valentine's Day to do it again. The Save Your Neighbor blood drive runs from 9 a.m. to 2 p.m. at the Lincoln Racquet Club off Old Cheney. It's a chance to show some real heart this holiday.
They are giving the gift of life, that it's such an easy thing to do.
The Stewarts are among 62% of the population who cannot give blood. Out of the remaining 38, fewer than 10% actually donate, some people perhaps misunderstanding the restrictions. Here's what you should know. There's no age cap, but you must be at least 17, weigh at least 110 pounds, possibly more if 18 and under, be in good health, no cold, flu, or antibiotics within a few days prior, no risk of HIV, AIDS, or hepatitis, no new tattoos within the last 30 days, and no lengthy stay as in years overseas. Vacations are just fine.
Think about you or your family If they need blood, wouldn't you wish that somebody would be out there that could give, that would give?
Becky says generosity bought Mike more time he was able to spend with his 4 grandchildren.
And to donate, you do need to bring along a driver's license. If you have more questions about eligibility, we have a link to the guidelines on our website, klkntv.com. Just click this story.
It's about the same size as an iPhone. It's a little bit thicker than an iPhone would be. This is really the brains behind the operation.
Many people think of their smartphones as a lifeline. This technology is life-saving. It's a key part of an implantable mechanical heart.
Pour a little hole in the heart here, and this end sort of sits inside the heart. The device, all of this sits inside the patient, and then we take this piece of graft, or this we call the outflow, cut it to size and sew it onto the aorta itself. Now the trick with these pumps is that you have to have a good right-sided heart.
Dr. Sagar Domley, a cardiothoracic surgeon, says several years ago the pump served as a temporary bridge to get patients to transplant. Now for some, they've become a destination.
We made the leap to say, well, why do they have to wait for a heart transplant? Why can't they just live with the pump? So now we have patients who are 9 years out on pumps, never got a heart transplant, living life, doing great.
People who get these are in dire shape. He says the 2-year survival rate without the device is 15 to 25% at best. With a mechanical heart, it's about 70. The first model was approved in 2008, and already across the country, about 17,000 implants have been done. 5 in the last 9 months at Nebraska Heart Institute. Bryan Health performs the surgery as well.
Within the Lincoln community, we've got about 10 people running around with these heart pumps, and you may never know.
So far, there's never been a primary mechanical failure. Domley is optimistic that we'll see a fully internal device within 10 years, but we're not there yet. In the meantime, patients still have to deal with an external cord, battery packs, and charging.
In most patients, we'll bring that out over on the right side.
That means no swimming or bathtub soaking, but a small price to pay for quality of life.
They're not only living longer, but everyone's living better.
In Lincoln, Vanessa Brown, Channel 8 Eyewitness News.
We are halfway through American Heart Month, and tonight the focus is on stopping that heart attack from ever happening.
There are several simple steps you can take, and we're not just talking about exercise. Here's tonight's HealthWise report.
When it comes to heart health, Dr. Steve Martin is great at intervention.
Stopping heart attacks by opening arteries and things. And of course, you got everybody's undivided attention when that happens, and they listen real good to you. But don't wait for something catastrophic like that to happen.
But he's hoping you can do a little more at home, starting with your diet.
You put bad fuel into your body, it's very difficult to make up for that, even with exercise.
Cutting down on red meat, eating more whole grains, a lower carb diet, all things he recommends.
We found out this year that avocados are particularly interesting in their ability to lower bad cholesterol, and blueberries seem to now lower blood pressure. So we find out new things all the time about different foods.
Martin, a cardiologist, can't stress this enough. Spend at least 5 minutes a week learning about what you eat.
Maybe get on your smart TV, go into Netflix, look up some of the documentaries, just do some diet studying.
Another tip, use modern technology to your advantage. Health apps and wearables are growing in popularity. With them, you can track things like blood pressure, heart rate, exercise, and even count calories, so you can count on living a long, healthy life.
Tomorrow night at 10, I will have an in-depth report on traumatic brain injuries in children. We will meet a high school senior who took a damaging hit in a football game and see how a special program at Madonna is helping him and those like him recover.
You know, one thing I like about these reports, you're doing more than just stating the problem. You're giving advice and some tips, and you have done quite a few of these. If people have missed them, no problem, right? We have them on our website?
That's right. Just go to klkntv.com under the Health tab.
Sounds good. All right.